the Eversource Hartford Marathon and Half Marathon. A lot of very fit people are coming to the city, because certainly nobody's going to argue that running isn't good for you. But there has been a bit of a debate, or at least a question for years, maybe decades now. Can you have too much of a good thing? Is prolonged distance running actually bad for your heart? Well, I have Dr. Paul Thompson joining me now. He's the co-physician-in-chief for Hartford Healthcare in its Heart and Vascular Institute. He's also a very accomplished distance runner. There's probably nobody in the United States more qualified to talk about this than Doctor. Good to see you.
Yes, thanks for having me.
Glad to have you here. Now, I think people might be a little confused, but I guess the parallel you could draw is maybe if you look at people who've been bodybuilding for decades, they have very large muscles, but then sometimes they can suffer from ligament problems and bone problems too. So is it the same sort of thing happening with prolonged distance running in the heart?
So we really don't know, but what it looks like is that you get the most benefit from exercise and exercise training when you go from nothing to something. Yeah. And so it goes down and down, and it kind of flattens out. The question is whether there's an increase, what we call a J-shaped curve, down with a turn up, whether there's an increase in problems in people who do too much exercise. Yeah. And that's hard to define. Now, why has it been hard to define? Because up until recently, there haven't been a lot of people who do a lot of exercise. Over-exercise is not our problem here in the United States.
This is true, yes.
Let me reassure you. So this is really a scientific question. It's not something that I think people who are running the marathon should worry about, but it's interesting from a scientific point of view. And the interesting thing here is that we learn a lot about healthy people and normal people when we study athletes, and so that's one of the things we're doing.
Well, we were mentioning bodybuilders before. Their muscles are just simply larger than our muscles. The same sort of thing happens with at least fit runners in their hearts?
So their hearts do get bigger.
Yeah.
The heart of an athlete is bigger. You know, the heart rate is slower, and that's because with each beat it can eject more blood. So the hearts tend to enlarge. We do not think that's deleterious or dangerous in any way. There are some other things that seem to happen with exercise training, and one of them is the idea that there may be some deposits of fibrosis, little areas in the heart which are fibrotic tissue. And we don't know whether this is a normal thing or whether it has long-term consequences. But let me go back to what I said originally. The most important thing you do is going from nothing to something. Yeah. Even standing up during the day reduces your risk of heart disease.
Yeah, we've heard that before. That maybe you can go to the gym for an hour a day, but then if you sit on your can for the other 16 hours, you're not as healthy as somebody who might be obese but is walking around most of the day. These, you know, I don't know how much credence there is to that, but there's something. Yeah, just getting up and doing something. But I am interested. These fibroses, how long have you been studying this? This has been a long time for you. Huh?
Yeah, I've been studying the benefits and risks of exercise for a long period of time. Way back in really 1979, we wrote one of the first papers looking at people who drop dead during exercise, because exercise, while you're doing it, yes, increases your risk. So it's like investing in the stock market. You invest for a long-term gain. You exercise for long-term gain. But when you invest, you may have a bad stock that goes. And when you exercise, some people actually have cardiovascular events that occur during exercise. So there's overall benefit from exercise training. We're interested in those small cases of side effects from exercise training.
And those people who die during strenuous exercise, the strenuous exercise may have triggered it, but it's not the cause. There's usually some underlying condition.
The underlying cause is divided in terms of whether you're older or younger. If you're over the age of 35, it's almost always narrowing of the coronary arteries from cholesterol. And many of those people, about 30% of them, have symptoms before they actually have an event. For a lot of people, they ignore chest discomfort. And one of the things that's ignored most frequently is actually discomfort in the top of the stomach, what we call epigastric discomfort, or discomfort right here. People think they're having an ulcer or they got heartburn. Get the point? Heartburn? Right. They think they're having something else besides what really affects their heart. So we always tell people, if you have symptoms that come on with exercise and go away with rest, that's your heart until you prove it otherwise. So check it out with your physician. Now, if you're younger, what kills younger individuals during exercise is actually congenital conditions of the heart muscle or congenital conditions of the coronary arteries.
How about people who are looking into a distance running schedule and have ramped up in a good way? Is there there sort of a magic number at which that J-curve starts to go up in terms of miles per week?
We don't know the answer to that, but it's clearly beyond what most people will do. So again, this is more of an element of scientific study, and can we learn something from these people? The folks that have been studied, who have been shown to have fibrosis and things like that, are individuals who have been lifelong endurance athletes. You know, the person that was a high school, college runner. And so they're individuals in their 60s and 70s who've done this all their lives. Most people should go run the marathon and have a good time and not give it a second thought.
So let's just stress that one more time before we go. We are talking about outliers here, and it's interesting, but don't read too much into that. Running healthy, that's pretty much the bottom line.
The key problem in the United States is not too much exercise. It's getting people off their duffs.
Okay, well, Doctor, thank you so much for being here. And once again, by the way, 2:20, I have to say, 2 hours and 28 minutes is the fastest you've run a marathon?
As my wife says, the older I get, the faster I was. Yes.
That is amazing. A very accomplished runner, and of course, very accomplished in the field of cardiovascular health, too. So thank you so much for being here. It's not the first time we've had you on. Let's get you back again sometime.
My pleasure.